Mucormycosis, commonly known as the black fungus, is a form of fungal disease, and the number of cases of this black fungus has risen so high during these corona times and has put an even more fear into the hearts of the public. So, who are all prone to get this mucormycosis? People with uncontrolled diabetes. In uncontrolled diabetes, diabetic ketoacidosis occurs, and that inhibits any organism from growing actually. But this rhizopus has a ketone reductase system which overcomes this keto reductase, and thereby it is able to live longer and cause more damage. And moreover, it impairs the glutathione pathway. When the glutathione pathway is damaged, what happens is that the macrophages, which goes and eats up the bad particles, becomes dysfunctional. People who have iron supplements or iron chelators, deferoxamine, the fungi uses this iron chelator as a siderophore. A siderophore is an iron carrier, and thereby it nourishes itself. Individuals who use corticosteroids, who have undergone a solid organ or bone marrow transplantation, or have hematological malignancies, in all these three conditions, they are treated with immunosuppressors. So thereby what happens is that there is decrease in immunity. When there is decrease in immunity, the patient is susceptible to various forms of infections. And during malignancies, chemotherapy is given. In chemotherapy, one of the side effects is neutropenia. As you know, neutrophils are responsible to fight off acute infections, with infections which are recent. And since neutrophil count is less, what happens is that the patient has no strength to fight against an infection. Individuals who have diabetes and have been affected by COVID-19, these patients are treated with steroids. So what happens is that one of the side effects of steroids is that it increases the sugar level and it decreases the immunity, thereby giving a much enriched foundation for the fungi to grow, and there are lesser amount of inhibitions to stop the fungi from cultivating. And individuals who have undergone trauma or severe burns, what happens in these conditions is that their vascular system is more prone or susceptible or has a greater chance in getting in direct contact with this fungus. And in these patients, they show up with cutaneous mucormycosis. So these are the risk factors, and if you come under any of these risk factors, please stay cautious, stay safe, and as always, be awesome.